Good morning, everyone. My name is Brian Carey. I'm Vice President of Marketing here at Unbound Medicine, and I'd like to welcome you to today's webinar entitled NCLEX, How We Increased Pass Rates and Retention. In this 30-minute presentation, Lori Hailey will be discussing some ways her and her colleagues have implemented a program that pushed NCLEX scores to near perfect. We hope you walk away with a couple of items that will help you with your program as well. If you have any questions, please submit them either in the chat field or in the questions field. And if we have some time during the live webinar, we'll answer them. If not, we'll make sure that we get an answer to you via email in about a week, within the week. Before we get started, let me tell you a little bit about Lori. Lori joined the nursing faculty at Arkansas State University in 2006. She moved to a 12-month faculty commitment in August of 2009 as a clinical learning center coordinator. In 2016, she accepted the position as coordinator of the Accelerated BSN Option Program and still serves as the coordinator for Clinical Learning Center and Retention, Remediation, and NCLEX. She currently serves on the Arkansas State Board of Nursing Simulation Task Force and is a certified healthcare simulation educator. At this time, I'll turn the presentation over to Lori. Hope you all enjoy.
Thank you so much, Brian. Good morning, everyone. So I'm so very honored. I'm excited and honestly a little bit humbled to be sharing all this information that we've been working on towards NCLEX. I know we're all in this together. It seems like on a daily basis that we're looking towards how can we have our students do better and what can we do, And so I'm just going to take you through a little bit of a timeline with us and what we did, and hope that you find some of the information helpful. And you know, one of my most exciting things about that is I hope to hear from you so that we can get some of your ideas and thought processes on what's been successful for your program. So just kind of progress through a little bit to talk to you about like the overall process. Is one of the things that when we started looking at this is that we knew that it wasn't just as simple as NCLEX Prep and let's get them the last semester and let's get going. So just a little bit about our program. We have a we're in the northeast corner of Arkansas in our program, and we're also what we call the Mississippi Delta. So, you know, but with Jonesboro, it's a town of about 50-something thousand, but we pull from all over. So we do kind of have a bit of an underserved population. So, you know, probably when we look at our students that we get in, we have, you know, multiple things for admission, but, you know, there are many times where our students aren't the 3.75 and above GPA. And at times, based on different statistics, we may even go down as low as a 3.3, 3.4. So sometimes our students come in and need a little bit of extra help. So just to kind of transition into how I started working so much with NCLEX is that when I came to work at A-State, I've worked in a multitude of roles, as you can hear, but one of the things that I quickly became doing is working with students who needed help studying, who needed help with test-taking ability. And so, so I've been working on retention and remediation a little bit along the way. And then about 3 to 4 years ago, they asked me to step up and take on the NCLEX Prep of it. So just to kind of take you through the first slide, the overall process. So about 4 years ago, I was asked to take on the role of helping work with our students to prepare for NCLEX in that last senior level course, which we all call kind of a capstone, to get them ready. And the first thing that I thought was, I can't come into the end of a program and start fixing, you know, testing issues or study issues or weaknesses that a student had and put a Band-Aid on a gaping hole. And so I said to my boss, you know, okay, I will do this, but I've got to start at the beginning. So I'll jump in the course right now. We'll start looking at things. But what I really want to do is I want to start working with students the minute that they walk through the door. I want to start preparing them. They need to know me. I need to know them. And I can't just walk into the end of an NCLEX course with all this data and not really understand or know who the at-risk students are and expect to look at where we're going. So to kind of back up just a little bit with it, we've always had a decent pass rate, and I don't like the word decent because I know none of us out there ever want to be a decent program. We're all the overachievers of the world as nursing faculty. And so we would run in the 80s. We were, you know, mostly at or a little above the national average, but the year that they asked me to step in, we'd actually had a 77.7% pass rate. And we were like, this is not okay. So that's kind of where I walked into the process to kind of help be only the coordinator. So getting them engaged and understanding the minute that they come in what we're doing was very important to me. So I'm going to kind of take you through that journey and then kind of talk to you at the end where we went to in terms of the NCLEX Prep. So we all know there's a 3-step process here. I'm not telling you anything new in that we want to look at, you know, how do we retain our students, because we know that that's so very important. We're constantly asked, you know, what's your attrition rate, what's your retention rate, and through that, to retain them, we have to have a very intensive remediation program and identify those at-risk students and kind of have someone that will be that coordinator of that position. And of course, the also important, let's figure out what in the world we can do to polish them at the end for NCLEX. So that's kind of the 3-step process that I want to take you through. So many years back, we were given a grant. It's probably about 6 years ago. We were given a grant to do a supplemental instruction program to where students were put into supplemental instruction if they did not achieve a certain exam score. And it was actually thought to be through this grant program that it would be someone who was non-nursing, but that they would work with the faculty and they would study with the students and kind of be a tutor. The problem with that became very quickly evident was that it was a negative way of thinking, and that students who had never had a punitive action in the world were actually feeling like they were being actually punished for not making a good grade, and that became they hated going. And so 2 years into it, I kind of was asked to step up to the plate and, Lori, can you look at going into SI? Can we look at what we want to do? How can we make this better? And what we actually did is I said, well, the first thing that we do is we know we have at-risk students and we identify them and we can encourage them and almost, you know, require them to be there. But I want this to be for everybody, and I don't want a student to stand out. And so we really struggle with finding the best strategy. And over time, what we found is that the students really were attending. They saw it being a positive approach, and attendance started increasing greatly. And on the next couple of slides, I'll kind of take you through that. So one of the great things that we transitioned from, and so I actually did a survey and a poster 3 years ago to where we had a satisfaction rating. We actually went on SurveyMonkey, and out of 74 students, 45 answered. So I felt like that was a really good percent, and 4.5, you know, 4.53 out of 5 satisfaction rating. And actually 67.5% of students reported that it helped them achieve a higher grade. Just some comments before we talk about the process. The previous approach, I pulled off those evaluations, what the students were saying. The class is a huge waste. This class does not help. And I actually think this next one's kind of funny because I studied more to keep from having to attend. And in all reality, I kind of don't know if that's a negative. I kind of think that may be a positive a little bit. With the new SI approach, I just pulled out a couple of the comments when we ran that SurveyMonkey. Gave excellent tips and strategies on test taking. The faculty knew how to keep us engaged and challenges us. And I love this class, and I get, you know, so much out of it. Actually says so much, but so much out of it. But that's how they actually wrote it. So kind of what we do in our SI instruction program is that we actually attach this time to the theory class that they have. So I feel like the most important part is in the fall semester when our sophomores come in. That's where I kind of focus on working with our students. And then the spring semester, I'll go over to the junior students because they need to see me, because I need to show up, because I need to constantly be kind of like, okay, Miss Hailey's there. And so they don't forget about me, so that when they're a senior and I'm working with them with NCLEX, they're ready to go and they know that this is a collaborative approach with us. So actually, I'm the lead faculty of the supplemental instruction, but as of recent, I've actually pulled in one of our newer junior faculty members who is one of my former students. And she actually was one of my peer tutors. And so she's come on board to kind of work with the students. So we kind of get that experienced faculty member with someone who is younger, who's been through the program and has kind of had to kind of learn the system as well. So we don't just, and we only do 30 minutes. I give them a 10-minute break after theory because I found if I give them too long, they find other things to do and they don't come back. I do have a sign-in sheet, but I don't single out anyone in this in this period. So we know who's required to be there, but no one would ever be the wiser that they need to be there. We do everything from test taking skills to study skills. And then of course, the most important thing that we do is the topics that the students are going to struggle with. So the lead, me as the lead faculty and our junior faculty member, we kind of get with the faculty that are teaching those courses and find out. So on this exam, what's one of the things that the students struggle with most? And let's say that that topic happens to be nursing process and how to actually implement it. Then we'll work a big part of that class period working on helping the students kind of go through that. We'll pull test questions up. We'll go through and study a PowerPoint, and then we'll pull a test question up. We'll tell them how to take that test question, and then we'll show them how they can relate it to that PowerPoint. Actually teach the foundation didactic portion. So I feel like I have to be real careful not being the person who does the supplemental instruction for my own stuff. So that's where Eddie Fleming, our other person that works with me on this, that's where she actually comes in and presents my information. And I go away at that point because I kind of feel like that's kind of giving the students an unfair advantage. So the biggest thing, I'm going to skip down to faculty buy-in. One of the biggest barriers that I thought that I would have to overcome when I took on this endeavor is how that I'm going to partner with the faculty, because if I'm going to be working with the students on issues for another faculty member, how do I make sure that that faculty feel that they're supported and respected? Because I am by no means the expert on that content from another faculty member. And we are very carefully that we have our monthly meetings, faculty meetings, I'm part of that faculty meeting and always do an update. And when one of my part of the updates is talk about what the students are saying, how much they're enjoying their classes, as well as ask the faculty if there's really any problem that they're having with what we're doing in SI, or they hear anything negative. Because it's never a time where I want to hear the student ever talk about that faculty member and how that faculty member is not being fair. And the minute that I do that, then we're going to lose the purpose of that. It's going to become a blame game, and no faculty is going to want me to work with students, nor is it going to be a positive experience for the student. So as a faculty, although I lead this, it is very much a team approach. Student buy-in, I think it's when they see the benefit. They see the benefit of when I come to SI, it's time well spent, and I do better on the exam. And students really need to know that, hey, there is a faculty resource that I have when I'm struggling to try to navigate the system, and what is my problem, and I'm that resource for them. And the motivation has to be there for them to come in. Kind of interestingly enough, when we hold an SI session, so I have 100 sophomores that we take on, I'll have anywhere from 80 to 90 sophomores that are there. And yes, of course, some of the ones that might need to be there that are just right there on the borderline that aren't required may not be there. But it's still a beautiful tool, because if they come to see me, I can look at them and go, hey, listen, I noticed that you don't come to SI. Can you kind of help me understand? Are you too busy? Is there something going on? And so it actually still serves as a resource for those students that are right there on the borderline. It sounds like it's a lot of work, and the most important thing that you have to have is administrative support. And I am probably, once I get through this, I teach about 50% in the classroom, and I actually have release time for all the things I do, from retention, remediation, NCLEX, and my coordinator duties. I have about a 50% release. So for supplemental instruction, I get a 2-hour release. So we work on a 12 to 15-hour credit load. So I'm actually given 2 hours out of that for release time to work with the students, and the faculty are very supportive of this, and administration is very supportive of this. And in fact, honestly, some of the faculty feel like I probably need another hour, but I don't want to take it, because I still feel like I really need to be in the classroom and be engaged from that avenue. So what does it take to be this person? And this is a role that I've just been creating. There's not a lot of information out there, and I've tried to research it, and I have talked to people from across the state that do this a little bit and try to brainstorm. But the facilitator, the person that takes this on, a lot of times I think, and not to say that young faculty and junior faculty don't play this important role. I mentor one student that, again, for this, also mentor a new student who's taken over my simulation pieces. And so I value that. but really to be able to go in and pull NCLEX and test taking and study skills, it needs to be someone who has a really broad knowledge base and has taught a lot of content. So, you know, my 11 years in a community college, I taught completely across the curriculum. And so I've kind of taught a little bit of everything. I consider myself, you know, a jack of all trades and a master of none. And the other thing is to be an NCLEX expert. And when I say this, I'm not one, but I've worked very hard to stay up to date on NCLEX and study and take lots of classes and really make sure that my continuing ed, that's a big part of it, because as we all know, NCLEX constantly changes and we struggle so hard to keep up. So, and the faculty are my resource for that too. They know if they hear something, they'll say, Lori, have you heard this? And I'm like, no, tell me about it. And then we research it and we talk about it at our faculty meetings. And then, of course, having a very good understanding of how the curriculum works and where things are in the curriculum and where our difficult areas are. So one of the things that I do is actually look at our the end reports that we have. We actually look at our predictors, and I'm always looking at them to see is, you know, hey, do we have a weakness in our curriculum, and do we have a content that our students tend to be struggling with, whether it's content or concept or you know, an NCLEX category, so that I can kind of make sure that we polish on that before they get to the end. I've got to be visible to the students. I've got to be visible to the faculty. So I teach a little bit in every class. I don't really, other than the foundations course, I'm really just part of every class and do some lectures and guest lectures and things, so that I kind of show up and go away. This person has to be a positive individual, and they've got to be able to be motivating. And the biggest challenge that I've had is I love the successes. I absolutely love the successes, and we have way more successes than we do failures. The biggest thing that I had to learn really quickly was that when the student had a failure, not to feel like I had failed them. I had to look at, okay, so they failed. So was there anything we could have done differently? And honestly, what's interesting is our students who fail, who do come back, will come and see me, and we'll work through the process and we'll partner together so that hopefully they can be successful. But if I lose that positive energy, then I know that that I'll burn out in this role. So I think I probably talked a lot about the remediation piece. Just to kind of briefly talk on this slide is that if a student is struggling in a course, and they want to try to figure out what, you know, what they're doing, then one of the things that I always encourage the students to do, they have to see that faculty member first and go through the exam with that faculty member. But then very frequently what the faculty member will do is go, okay, Lori, I've talked to them. Here's kind of what I think. I'm going to send you an exam and some PowerPoints. Could you sit down with the student, and could you and the student have a 30-minute study session, and you try to see if you can help figure out how that they can be more successful, whether it's test anxiety, testing behaviors, study patterns. And so again, with that piece of it, that's part of my 2-hour release that I get to work with those students once the faculty's initially seen them. Through remediation and through retention, through an evaluation, some of the things our students have said is that I now do better on our HESI exams, and that's the exams that we use for us at the end of a course, the standardized exams that we use our HESI. Actually made an A on the exam. I never had to study before, and I just don't know where to start. This helped me so much when can I come back to see you? I really feel like the faculty care that I succeed, and that to me is probably one of the best statements. I feel comfortable asking for help now, and I wish I would have come sooner. So, and the reason there's really no negative comments on here is because we did not have any negative comments. So the students really feel like this is a great resource for them. So now let's get down to NCLEX Prep. And one of the things that I've learned through all of this, and I learned something new, I feel like on a daily to weekly basis, is that there's really no perfect resource out there. Very frequently in schools, and we had a tendency to do this, but a couple of the other senior colleagues have mentioned to me a lot of times, like, we don't need to put all of our eggs in one basket. And what I mean by that is that we don't just use one standardized testing approach, but we're consistent in the ones that we use. So you heard me mention that we use HESI as our standardized finals, and we use HESI predictors as our predictors of success for NCLEX, or at least identifying our at-risk students and look at their weaknesses. Throughout the program, we use another product for testing that is adaptive testing through PrepU, and we have our students use that platform. And then at the end, we use an ATI product to work with our students to get them ready for the NCLEX. And the reason I like that is because I think it hits on every possible weakness that a student in or our program could possibly have. Because do we have a testing issue? Do we have a content issue? Do we have a student study issue? So, and we found that to be very advantageous. So we don't just use one product, but I think you have to be real careful, because you don't want to just jump around, because your students will get very frustrated and not know how to use the technology piece of it. And we use a lot of online apps on our phones for our students to constantly have questions at hand. We start hitting on that when they walk in the door at the ones that are best for them. I always tell them that, hey, before you pull up social media, go in there and go onto your one online app, spend me 5-10 minutes on it, and then go hop on Snapchat or, Facebook or Instagram or whatever it is. And so they kind of get in the habit of actually trying to use their phones in a positive sense. So we all know that we work so hard. We have this course. We keep them motivated to graduation. But then after graduation, we lose them. And so one of the things that has probably stood out most is that we have to find a way to keep them motivated up to the time of their NCLEX exam. And that requires staying in contact with the student and knowing those at-risk students. So I'm actually a 12-month faculty member, because we have an accelerated option program. So in May and June, when of course, our biggest cohort graduates, obviously in May, we usually have about 70 to 80 something students graduating. Actually stay in contact with them and reach out to them. And I'm building that rapport with them this last semester in their NCLEX class, so that when they get to 100% in the review course that we require, we actually talk by phone conversation or in person. And we visit for a while to look at what they're going to do over the next couple of weeks as they're released to take their NCLEX examination, what they're going to do to work on it to stay engaged. Because we all know that, when you're looking at taking the NCLEX, one area that you can't show that you're proficient in could actually take you to 265 questions and can actually keep you from passing the NCLEX. So we talk about this process all along, so that the students kind of realize that you have to polish your weaknesses. And none of us like to work on our weaknesses, myself included. And so part of my job is to help to go, this seems to be one of the weaknesses that we've noticed, or the students brought to me their weaknesses, and we stay in contact. And really, I've even stayed in contact with them is the day that they're driving to the exam, and they may call me and say, hey, Miss Hailey, I need you to talk me down. I have test anxiety. Remind me what I'm supposed to do when I go in there. And yes, I realize that might be 6:30 in the morning, and I do give parameters to the students as to, hey, when you can call me and what the times are. But my schedule becomes very flexible in May and June. And so the good thing about that is that I'm allowed to. So if I'm talking to a student at 9:30 or 10 o'clock at night, I'm okay with that. It doesn't burn me out. But what I do know is the next morning, I may not go in until 10 o'clock in the morning. And so I give myself time back, because I'm very passionate about what we do and I believe in what we do. So being able to be there for that student and hopefully keep them successful and kind of calm them down, or give them some encouragement, I'm completely good with it. And that's the only teaching load that I have in May and June, is just focusing on the students, working with the students, and being there for the students. So again, that very strong administrative support. This is ongoing. This is ever changing. Actually, I know that I'm going to have to do some really big studying in May and June to look at the changes that are going to be coming on to NCLEX, because I don't feel like I know enough, and I'm really worried about it. I know that I'm going to have to learn more about how we're going to prepare our students for the examination with the new changes. And so it's ever challenging, but I kind of like a challenge. So that works for me. There's days I'm exhausted and I find myself not being positive. And so I have to take some time and take a step back and maybe call one of my colleagues in, and go, hey, can you tag in for me a little bit? Guys, I'm wearing out. But overall, it doesn't usually last very long, because seeing the students be excited and motivated and understanding the process is very much, I don't know, it's that adrenaline that we all like. So our previous process was simply just to have the students go take a review, just any review, if they didn't have a certain score. And then once they did that review, then they were released for NCLEX. Well, that wasn't working. I mean, we were having 82s and 84s and 86s, and 1 year 77.7. Students cannot choose the best review for them because they don't understand it. There are beautiful reviews out there. We have those reviews that we know are good for the, if we've got a little bit of content issue, then we know there are reviews that are really good on that, but we identified we didn't have a content issue. Is it a testing issue? And if it is, there are programs that are very specific to that. We quickly fixed our testing issues. I don't know if we quickly fixed it. We fixed it and we worked on it pretty hard, but we realized that we had a few testing issues and we worked on those. So our biggest thing is having students work on their weaknesses because we didn't seem to have an overall program weakness. So we chose a product that kind of encouraged and push the students to have to do it and to have to work on their weaknesses, because that seemed to be the best fit for our program. And then for those students, some of that particular program wasn't enough. So I actually will look at the student and offer other resources that are available out there on the market that are good to meet their needs. So I may say to a student, you have a testing issue. This would be a really good product for you. Or you have still some content issues. Let's go back through this particular review book and let's work on this process. But I'm always here for you, and that seems to be working amazing for us. But again, it took probably the last 2 to 3 years to actually perfect that process. I was terrified when I took it on. Like, what if I do this and I don't know what I'm doing, and I tell the students the wrong thing? And they don't do well, and I was going to feel like NCLEX was completely on me. That's not the case. I'm only the coordinator of that, and I quickly got over there. It took me about a year. I will tell you that when we now make all of our students take the same review, that first year they were angry. Nobody likes change, and all the faculty we didn't have 100% faculty buy-in. So that first year, in the course that I picked up, I had never had really bad evaluations from students my whole entire life. Now, of course, I had a few bad evaluations, but overwhelmingly, I'd always had strong scores, mostly positive comments. That particular year, the comments were quite harsh. The students did not like it. They thought they knew what was best. How dare them require us to do this? They wanted to take this review. They had heard this about this. And it took me about the next 6 months to actually talk to faculty about what we were doing, us to figure out more what we were doing. We started to see better results immediately, so that helped. And really, when I went into the NCLEX class, looking at the negative comments and looking at myself and going, okay, yes, Laura, you could have done those things differently. Why don't we do this? And actually, honestly, market it better. I found out that I had to be a better marketer to the students. And so I brought former students in that had struggled, former students in that we had worked with that were really successful, so that the students could see, okay, this works. And as of now, we're really doing pretty strongly. And I think this probably speaks for itself. So in 2015, and I'm terrible with dates, so that's why I probably skipped around on timelines for you guys here, but that was our lowest pass rate, 77.7. We were like, oh my goodness, what do we do? The next year, even the year that they annihilated me on my evaluations, we still had an 89.7. And so what we were doing was working, but we felt we had some more ground to cover. 2017, we went up in the 90s. We were excited. And this year, out of 104 taking, we actually had a 96.1% pass rate. And I will tell you that being in the course right now that I'm teaching, the students are there and they're ready to go, and there's complete buy-in. They're already coming to see me before graduation even happens, and we've been working on things. So, we're excited. We hope we keep this up, but obviously every time we go to have our students take NCLEX, we have that anxiety moment that we wonder, okay, well, what if these are all just flukes? And what if all of a sudden, we go down to 77.7, what do we do? And so the thing that I constantly remind myself of, and remind the faculty of, and the faculty remind me of, is that, you know, what we're doing is working. We continue to monitor ourselves closely. We go to curriculum retreat, you know, for 2 long days. I don't know why we call it retreat, because it's absolutely not retreat. But we look at everything, and we're very open and honest. And if we expect our students to look at their weaknesses, then, you know, we have to be comfortable looking at our own weaknesses. So creating a culture of comfort with the students to talk about their weaknesses. But, you know, guys, they're only going to be as good as their leaders. So we have to create that culture of comfort among ourselves to look at our weaknesses. And I kind of lead the champion on that. I'm like, hey, if we've got a problem, let's talk about it. Let's fix it. I've shared those evaluations with the faculty, and they're like, oh my goodness. And they were brutal. So just to kind of show you, I know this is a lot to handle in a very short period of time, but again, that's what we can, you know, reach out to each other via email or questions. And I would love to hear some of you guys' ideas and what's going on. But so this last particular year with our traditional students, we had 74 graduate, and out of that, a 95.9% pass rate. Because of course, because they're both bachelor program, we have to mesh those together. We had 71 out of 74 that passed the NCLEX. Now, after this becomes a self-reported thing. So again, you know, I realized that some of these statistics could be skewed, but basically we had 52% of our students that self-reported that they shut off at the minimal. And of course, all of those students passed. And that to me spoke volumes. So they had worked on their weaknesses and they were successful. That was just amazing. Another 10%, almost 11%, shut off at 90, or somewhere between 75 to 90. So we're looking at, you know, a huge percentage of our students. So we knew what we were doing was working. 7 reported shutting off at 265, and 3 of those, of course, were failures. So our failures were at 265. And as I looked at their reports, you know, basically they were at, you know, near the passing standard, but they just had not worked on their weaknesses. And so the exam took them all the way to 265. And, you know, I had a few that didn't follow up, but a very small portion. And then actually there were a few that were just in a varied range. So what I'll tell our students is that, you know, it looks like we have a trend to just shut off quickly and to be ready. And one of the things I'll tell you the students have told me is that, hey, I felt prepared. I felt prepared for the NCLEX. We had never heard that. Usually what we would hear is, oh my gosh, that was the hardest test I've ever had in my life. I've never seen questions like that. And now what we're hearing students say through the process that we're doing is, you know, hey, I was ready for that. And the people that took 265 said, you know, Miss Hailey, gosh, I wish I would have done what you and the faculty told me. I just didn't study enough, and I took 265. So I get them prepared to take 265. The accelerated program option is a 13-month program of the curriculum with a second degree student who actually comes in a little more mature and a little more motivated, but they actually do the curriculum in 13 months instead of 3 years. We had 28 out of 20 that passed. We had one that just decided to not take. I really don't have an explanation for that. 69% of that class shut off at 75%. And so we only had one failure with that piece of it. So I guess my biggest thing is, and those are of course self-reported, and I heard from all the students in that cohort because I work with them and it's a lot smaller cohort. I tell them to reach out to me and let me know where they shut off and when they passed. And most of the students do. They send me a text message or an email, or we have a phone call about it. A lot of times I'm the first person they call after they take the NCLEX. And of course I remind them, you know, ethically, hey, don't talk to me about your questions that you had, but they just want to let me know I shut off at 75. Oh my gosh, you think I passed? You know, kind of things before they call their mother. I tell them to hang up and to let me know when they passed and go call their mom or they call their dad. But that I think what we're seeing is, and this is good information for our students. I share this information with the students because it lets them know that what we're doing is working. So I know that's been fast and that's been furious, and I hope I've made sense to you. So I guess this will be a good time to see if we actually have any questions.
Thanks so much, Lori. This is Brian Beck. We did have one question, and I think you touched on it a little bit, but maybe you can go into a little more depth on whether you use one of the popular testing systems, whether an ATI or HESI or Kaplan, and how that fits into your program.
Oh, okay. So yes, for the NCLEX class, we felt that it would be less daunting to use a program that's already packaged for us to keep from having to have so much faculty work with 70-something students. So we actually chose to, at that point, we used HESI all along, but at that end, we actually used the ATI product, and we used their capstone, which is like a 7-week course. That's actually what I tell the students is the review before the review. And then at that point, they do that for about 7 weeks, and then we do some predictor testing, but we actually still use HESI for our predictor. And then they actually, before they graduate, they'll actually start the virtual ATI. We call it VATI. It's an online review. And so about 2 to 3 weeks before graduation, we actually have our students already engaged in the review. So they can get to 100% and complete very quickly post-graduation to take that. And once they get to 100% in that review, then we know that they're ready to be released and to take the NCLEX for us. So that's currently the program. It seems to be working really well and helps us to keep from having to do so much man hours on the faculty end.
Excellent. Thank you so much. That's just about the time that we have today. I do see some other questions that are coming through. So please keep in mind that every question that is asked, whether it's now or in the near future, will be answered and emailed directly to you to answer that question. Also want to let you know that the recording in the webinar today was recorded, and everyone that signed up and registered will be getting a copy of the webinar delivered to them via email. If for any reason that you don't get it or you don't see it, please feel free to reach out to Unbound Medicine anytime, and we'd be happy to get that to you. It will also be posted on our website. So at this time, I just want to really thank Lori and to everyone that attended the webinar today. Just a quick reminder that Unbound Medicine does have an NCLEX app, NCLEX RN Quest, that is really nicely integrated into our flagship product with Nursing Central. And if you're interested in learning more about that, feel free to email us or to visit our website at any time. We really look forward to the next webinar, and I want to thank everyone again for attending. Hope you have a great day.